Good evening, Select Board and FinCom. I'm excited to be here. My name is Penelope Fanioli. I'm the Director of Health and Human Services for the town of Acton. I've been here for 1 year and 10 months and excited to be here for a long, long time, so that's exciting. In the Department of Health and Human Services, we have 6 divisions with 5 department heads. Our 5 department heads are excellent. They've been serving your community for a very long time and they care very much about their work and the people that they serve. So I couldn't be more proud, and in some ways, that makes the job just so much better, not in some ways, it makes it so much better to come in every single day. But it also makes it a little bit easier when you have really highly competent staff. The Health and Human Services budget starts on page 131. In our department, we have 17.775 FTE, or 22 staff people who are supporting individuals. We are also supported by 2 regional staff. This is funded through a public health excellence grant. One is an inspector who supports our inspectional services. The other is a community health and wellness coordinator. She does a tremendous amount of work to support me directly on many of the initiatives that we're working on, and and we'll be rolling out mental health first aid and buried in treasures and other programs, education programs that are supportive to our community members. You will see in our org chart that it changed slightly. The community services and transportation director and the human service administrative assistant were taken out of the town manager's budget, put under the health and human services budget. They work under my direction and that's where they should be. So that's where you will see a change in that. We've added some new staff. 2 positions were unfilled and Heather York was filling them for a long time. So I think this is probably the most proud thing that I am to report, is that we have an incredible public health nurse. We're sharing her for a third of her time goes to the town of Littleton. And in many ways, it's so efficient because she's able to be at statewide meetings and be on all kinds of different, calls, but also she's able to do disease tracking and contact tracing throughout the week for both towns, depending on the case counts. We also have our on-call and per diem nurse, Davine Arrigo, phenomenal employee. We couldn't be more happy to have her support us. She does over the weekend calls and she does cases throughout the week occasionally. We've also reorganized some of the budget of the health department so that we can really support our inspectional services. The town, before the reorganization for Health and Human Services, had a director of public health and 2 health inspectors, and an administrative assistant. In that time, they still contracted with a food consultant to do food inspections. That consultant is no longer doing her work in our town, but that gave us a real opportunity to take the dollars that contract was providing for those inspections, and we're able to increase to 300 hours instead of 100 hours of her time. We now have 400 hours of food inspection and weekend inspections. So we've hired Michael Seeger. He's a well-trained, well-seasoned food inspector. He's working in other communities, but he works for us on the weekends now. So we'll do Friday, Saturday, and Sunday inspections for food service. We'll be able to do our farmers markets, weekend housing calls, any sort of emergencies that happen over the weekend. We have a weekend inspector now. It was a major gap that needed to be filled, and I'm very proud that we did that, and that we have a high quality individual supporting us. The role of Health and Human Services for the town is really critical. We are the backbone of a healthy community by protecting public health, supporting vulnerable populations, and addressing both social and environmental factors that influence health. We create a town, or we help to create a town, where people can live, work, and thrive. And I think that's really important because one of our key performance indicators is a lot bigger than an indicator. It's an impact. Impact is hard. If I could have a behavioral economic person in my department, I could probably pump out a lot of ways that we're saving money for individuals in this community, because our nursing services addressing someone who's had a fall or a hip replacement, then they're asking them to come back, go to a balance class, come back to a maintenance class, come to the COA and hang out and enjoy yourself. It's also a third space, just to keep that in mind. It's free and it's really exciting environment. I love it so much. If you love puzzles, come on down. But that said, we are supported by our colleagues. We can't have healthy, thriving individuals in our community if we don't have the library doing cool and exciting things in the evening, or having great, steady program, or the rec department expanding what they're doing and looking at different ways to provide recreation in our town. The one thing that I keep hearing over and over in this community is that everybody wants the same things that happen at the senior center in all ages. So that's so exciting that everybody wants to be together. They want to be enjoying and learning as a team or as a group. But we are always faced with real concerns. We have people who come through our doors that have extreme hardships. So our jobs are not easy. They're not always happy and fun. We have increasing demands on social services for all ages, especially seniors. We have minimal services there are challenges in elder services, both in funding from the top down and staffing that they have to support our elders. So it often falls on our staff to support at a higher level than what may be expected of a community. In November, there was a significant rise in food insecurity. I think we all know what happened. We responded very quickly. We organized our food system. We got talking to each other. What's the need? What's it? Good news. They had it figured out. This is one of the most well-oiled food systems I've seen in municipalities in my career. It's amazing what's happening here. But they always need help. We need to convene. We need to make sure we're on top of it. So we are. But there's even more demand for housing needs. We do not have money to support residents who are going to miss their rent that month. At this point, the only thing that we really are helping with, and we are getting a lot out of it, is our housing legal clinics. These, if you remember, ARPA dollars were centered to have a housing clinic. So this is a monthly conversation with individuals who are facing major housing legal concerns. We've been able to support individuals that the health department was going to legally push on their housing issues. We've said, why don't you talk to this legal service? And it helped move the whole process faster. So that is a huge, huge asset I wanted to point out that we are still utilizing. We are data-driven. We want to do data-driven decisions. We've been working on our data collection and really improving a lot of different ways in which we're doing that. So we know that OpenGov came through the town about 2 years ago. The health department has 40+ permits. It's very different than the building department and the planning department. When we entered all of our permits, we were doing it very quickly because we were also operating a health department and transitioning from paper onto line. So what we're doing right now with that is we're going through methodically our large permits and looking at inefficiencies in our permit workflow. We're looking at ways that we can better track using OpenGov the work that we're doing, so we can have our septic inspections, boom, 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 in the field on a tablet. All of this stuff is coming and we're building it this year. I hope to be able to report much more detailed information from OpenGov next year. My Senior Center is an amazing tool. You look at it and you think, oh, is this Netscape 1997? It's not. It's super sophisticated. We moved to My Senior Center for our transportation system to monitor and to schedule our rides. It has increased our service availability because of it, because of the way that they built their transportation system. We're very happy with that. Laura will expand on that. And then, as you know, many of you know, maybe not all of you know, but I'm doing community listening sessions or focus groups in the community. We've had, Wanjiko, I believe, spoke about this last night. We're doing this as a team. We have similar outreach efforts. There's no reason to do two different tracks for that. We're doubling up and helping each other out. It's really been so amazing to talk to our residents. That's my favorite thing. I like people, that's why I do this. So I'm very happy to get to talk to everyone. I just completed one a couple hours ago. With that data collection, we will then bring back what we've learned through our narratives, and we will bring it back to the community and then reinvigorate a strategic planning process. So that's coming up. How do we stay afloat? We try real hard with all the ways that we can. We're looking at donations, of course. That's where we get all of our great free programming at the Council on Aging. Donations that go to the Acton Nursing Service for medical care and for podiatry clinics and all kinds of ways. By the way, podiatry clinics can save lives too. That can really extend your life, getting your feet cared for, believe it or not. We get direct reimbursements from the state for our veterans officer. So we pay 25%, 75% comes back to us, right? I got that right, okay. We are looking at grants all the time. Any grants that we can find, we want to grab. Grants are difficult though, because if you try to build something that you're missing in your department on a grant, how do you sustain it? So those are also very tricky and need to be thought about when we're approaching these grants. The permitting and the fees that we get from that, and then finally insurance, right? We get a large amount from the nursing service through insurance payments that help move our services forward and support our residents. I want to highlight the Public Health Excellence Grant. It is really, really providing a major service to us, and especially in our inspectional space. And if that grant does go away, we have to have a deep conversation about that. We will not be able to cover our inspections if we do not have that support of that regional staff. She's highly qualified. She's doing an excellent job with our hazardous materials permits. And we really need that support. So fingers crossed they don't cancel this grant in the next few years. The behavioral health programming that I talked about that SRAE does, and the townwide mental health first aid Barrington Church. I already briefly talked about that. So what are we faced with? We're faced with growing demand of need, high need, really complicated needs, complicated housing cases, complicated social service calls. All of these could use a clinical lens on it. We are not clinicians in the clinical therapeutic space. We are all caseworkers in this department. A therapeutic component would support moving these cases faster and more comprehensive support for the individual, getting them connected to the services they actually need. The other thing that's happening is everybody wants to be in our programming. So we have wait lists for watercolor and for horticulture and for podiatry clinics. And residents are not happy that they have to be on a wait list, or that their regular program that they love, they couldn't get into because their call went in too late in the day, and others wanted it. So we have a bit of a challenge where we really could double up our services, but we don't have the staff or the capacity to do that. So we're not asking for anything, but I'm telling you that that's a fact for us. And we want to do more for our community members. And then just the fact that, the federal government down is not funding public health, emergency preparedness. They're taking dollars away from mental health and substance abuse services. So let's say that it is not an indicator right now for what I'm hearing in the community, but let's say that substance use or mental health was a major issue. We wouldn't have access to those grants, and those grants are very helpful. They can really change lives. So this is a real challenge for us. We're gonna keep being light on our feet, tactical, and looking for ways to continue to cover our service and the needs of our community. Typically I would turn this over to Matt Dow to speak for the health department. He is not able to make it due to a family emergency, so I'm going to do his presentation for him, which is great because I enjoy being in the health department. So Matt has been with the town for almost 10 years. He's coming up on 10 years. We have 3 full-time employees in the health department, Matt, Way, and Jen Schmidt. She is now our administrative assistant. She is making a huge impact in only a few weeks. And again, because we're a part of the Northwest Public Health Coalition, which is the Public Health Excellent Grant, that is the other staffing that we have that supports our office. And then I already discussed the per diem inspector, the weekend inspector. So our budget for the health department is on page 134, and the actual budget details are on 137. There's an enterprise account and revolving budgets you can find on 165. So the health division has general oversight of operations, including food, septic, camps, pools, housing, body art, body works, freshwater beaches, emergency preparedness, hazardous materials, and sealers, weights, and measures. These are a lot of different things that we're covering and we're watching out. And one thing you can know is that if you haven't heard about a controversy at your food establishment, we're doing our job. That's an impact, right? No one's getting sick. This is all because we're here helping out, making sure we're silently supporting you without you even knowing it. Very exciting. But I do want to say just a little touch to tack on to what Chief Arnhem said. We in public health have a high responsibility for public health emergency preparedness as well. I've been working with her and with Andrea through the Sustainability Office, looking at those resources from the public health entities, the emergency management side, the sustainability side, and we're all working together as a team. I am on the board that oversees our Medical Reserve Corps, so I will be helping with the volunteer recruitment and the work that we'll do with that. And again, we are expected to provide and to do the work to ensure that our emergency preparedness plans are in place, that our that our shelter is there, that we have all the resources we need. So public health has a deep role in this as well. So we're responsible for 5 budgets, 1 general fund and 1 enterprise fund, 3 revolving funds. All proposed budgets have level funded with the exception of position control that I mentioned earlier. I'm sorry, this is his speech. I don't know what I said earlier, so I'm gonna, sorry about that. As you can see from the performance metrics on page 136 in year 25, some permit numbers we have issued have decreased from the prior year. For example, food metrics are down a bit from last year. This is due to food establishments closing and less temporary food events in general. We do have a few establishments opening, and that is a more intensive process for our food inspector to go in and get all the setup, make sure that we review their food plan. So there's good news in that, and that I know that we're working really well and closely with our economic development director, Patricia Costa, who's phenomenal, on making sure that we get our businesses here and that we want businesses here. We need jobs and we need good community, working, whatever, the money moving around the community is what I meant to say. The hazardous materials line, you could take a look at that, and you'll notice that we have brought that cost down. We only ran 1 hazardous materials day last year, and it was successful. We will continue to stick at that rate. If anything changes, we would have to come up with some money because it's quite expensive to do a hazardous materials day. But thank you for your time. And the other notes that he has here, I just want to say, is that our fees are in line with surrounding communities. So we don't have a lot of opportunity to increase fees to increase our budget. And that, again, we're trying to continually make sure that we're tracking our inspections and that in each education moment that we get, that we take the time to do it and spend that time with our vendors to make sure they understand our public health concerns and that they operate them properly. Thank you.